Hello, in this video, I will be talking about abemaciclib. What is it? When do we use it? What are the side effects? And how do we manage those side effects? I do want to mention that this topic is being covered because of a comment from a viewer just like you. So don't forget, you can always put a comment or question, and that might lead to us doing another video. Before I go on, just a reminder to subscribe to our channel. We're always putting out new content. There's always something new to watch. So abemaciclib is one of the drugs we call a targeted therapy. It's targeted to the CDK4/6 enzyme in breast cancer cells, and the drug itself inhibits that enzyme. So you might see abemaciclib described as a CDK4/6 lowercase I. That stands for inhibitor. This is a drug that's taken orally by mouth, so it can be quite convenient, and it's used in people who have hormone receptor positive breast cancer that is HER2 negative. There are two situations in which we will use it. One is in people with advanced disease, so cancer spread all over the body, and another is in people who have high risk breast cancer that's already been treated with chemotherapy and surgery and other therapies as appropriate, but it's used as an adjunct after all those other therapies, along with endocrine therapy. So whether it's being used in people with advanced disease or people with stage 3 or stage 2 disease, we will use it with endocrine therapy, usually an aromatase inhibitor, like letrozole, anastrozole, or exemestane. You can check out our videos on the aromatase inhibitors and also our other video on CDK4/6 inhibitors to get some additional information. The way this drug works is it appears to interfere with the enzyme CDK4/6, which is involved in cell reproduction, cancer cell reproduction. And it basically gets in the way. If you want to think about it as interfering with the gears that help cancer cells divide, we want to stop that process. And along with endocrine therapy can cause cells to stop dividing. The way cancer cells cause trouble is because they keep dividing. If we can stop that process, that can lead to cell death. And just like sharks, cancer cells are not any good if they're not moving. Cancer cells are actually pretty fragile. And the way cancer causes trouble is because it makes more cancer cells. Very few cancers cause trouble because they stop, they live forever. It's usually because they keep dividing and dying, but keep dividing. So we want to stop that process, either by starvation or by assassination. And the combination of two therapies can be really helpful in improving outcome. The CDK4/6 inhibitors, like abemaciclib, have been studied in people with advanced disease and higher risk disease, like the MONARCH trial studied this class of drug, in particular abemaciclib, in people with ER, PR positive, and HER2 negative breast cancer. Now, the drugs can cause side effects, as can really any drug. Remember, even placebos can cause side effects. And in particular, the people who've put comments and questions in our YouTube videos have been people who are on other medications. So they might be on an LHRH analog. They may also be on an aromatase inhibitor, and now they're also on abemaciclib. And it's really hard to know which of those drugs is causing side effects, because they can all cause side effects like fatigue. In particular, abemaciclib and the other CDK4/6 inhibitors can cause low white cell counts, and that can cause people to be at increased risk for infection. So we look at, when people are on multiple drugs, the profile of every drug that they're on, and all of these can cause fatigue. So if you go through menopause because you're on an LHRH analog, or you received chemotherapy, or you're on an aromatase inhibitor, all of those can cause fatigue, and as well as dealing with breast cancer and all the other changes in your life. The low white cell counts are undoubtedly due to the abemaciclib and the increased risk of infection. is undoubtedly due to the abemaciclib. But the other side effects, like the rare person who gets shortness of breath, that can be from the aromatase inhibitors and sometimes from the CD4K inhibitor. So you can see it's kind of hard to know. So I'll make the analogy. If you have a dish and you have a reaction, let's say you break out in a rash, and the dish had seafood and it had onions, you can be allergic to seafoods and you can be allergic to onions. So we usually have to do an elimination diet where we eliminate either seafood from your system or the onions, and then we reintroduce them. It's the same with any medications that are taken in combination. So we'll stop one drug and we'll keep the other going. Wait till that drug you've stopped is washed out, which can take a couple weeks to a few weeks, and then reintroduce it and see what happens. So that can help us figure out which drugs are causing the side effects. In the meantime, you might feel like a human guinea pig, and you kind of are, because we're testing these drugs in you, but it's because we want to identify which one's causing the problems and which ones can be reintroduced into your body. The other side effect that we can see with the CD4K inhibitors, like abemaciclib, is nausea. And we can also see that when people are on endocrine therapy without the abemaciclib. But abemaciclib is known for causing nausea more often than endocrine therapy. Again, if you get these side effects, talk with your medical team, because it's not harmful to stop a medication for a few weeks to see how you do. What's really harmful is to tell you you're going to be nauseated for a year. So yes, we are dedicated to keeping you on good treatment, but we're really dedicated to helping you feel as good as possible. How do we manage these side effects? Well, the first thing is to identify, is it the medication that's causing them, or are you having symptoms of the breast cancer or of the other medicines that you're on? The other thing we'll do, especially for low white cell counts, the neutrophils, is we'll monitor you closely. In general, unless there are breaks in your skin or in the mucous membrane, most people do not get serious infections. But it's important for you and your medical team to know that this can happen, so that if you show up with a fever, they know that you might have an increased susceptibility to infection. And then the key thing, as always, is just to stay in touch with your medical team. If you develop a symptom, they need to know about it. You don't have to wait till the next time you go see them. And if they tell you it's not likely to be from the medication, you can say not likely or not at all. In other words, yes, they may not have had somebody with this side effect, but if that's your experience and you stop the medication and it goes away and then it comes back when you reintroduce it, that's something we actually like to report to the FDA. So don't let somebody sort of shut you down. You know, don't let people say, well, because I haven't seen it before, it can't be from the medication. It's really good for all of us to stay curious and open and to listen to you, and to make sure the manufacturers and the FDA know these can be side effects. Really, the bottom line is that communication is key. I've covered a lot. I hope it's helpful. If you have questions or comments about your own experience, you know, one of the things about the yerba community is that's so beautiful is for people to know that they're not alone. We hope that our videos help you feel that way, but the stories you share with each other create that community, and we love seeing that you're supporting each other through information support and through helping people feel they're not alone. As always, thank you for watching.